You know, in dentistry, a truly great restoration isn't just about that final, perfect polish. Nope, it's all about the groundwork. So today, we are going to build the ultimate preoperative checklist. These are the mandatory steps you absolutely have to take before you even think about picking up a handpiece. This is the foundation that separates the good from the great.
So, let me ask you a question. When you think about a successful restoration, what's the first thing that pops into your head? Maybe it's the perfect carving or that flawless anatomy, right? And yeah, those things are super important. But what do you think is the single most critical part of the entire procedure? Well, the answer might actually surprise you. The most crucial part of any restoration is everything that happens before you even start. Your success or failure isn't decided when you've got the handpiece in your hand. It's determined by how thorough, how meticulous your preparation was.
And that is exactly why we need to stop treating the pre-op phase like some kind of warm-up. It's not. It's a formal, structured protocol. You got to think of it as the blueprint for your clinical success, especially when you're just starting out.
And let me be crystal clear about this. What we're about to go over isn't a list of helpful hints or friendly suggestions. For any clinician who's serious about excellence, this is your mandatory pre-op checklist. It applies to every single procedure, every single time. No exceptions. So, where does this protocol begin? Well, it's not at the dental chair. It starts at the desk. Before you even say hello to the patient, your first responsibility is to their file. This is where you do all the strategic thinking. And this desk work breaks down into 4 clear parts. First up, you're going to review the patient's complete medical and dental history. Are there any allergies, any conditions we need to be aware of? Second, you confirm the exact treatment plan for this appointment. No guessing. Then, you analyze the radiographs to really understand what's going on under the surface. And finally, you do a quick clinical exam to make sure what's in the chart actually matches what's in the mouth. And hey, don't just take my word for it. This is the standard of care. The clinical guidelines are very clear. All the heavy lifting, the exam, the diagnosis, the planning, all of it has to happen before the patient is even on the schedule for the procedure. The planning stage is its own separate, dedicated event. All right, desk work is done. Now we can move into the clinical phase. And this part is all about preparing the operative field. We're creating the perfect environment, one that keeps the patient comfortable and gives you total control. Now we have 2 key steps here, anesthesia and isolation. They have different goals, but they work together. Anesthesia is for the patient. It's about their comfort, which lets you work without interruptions, and it also helps cut down on salivation. Isolation, on the other hand, that's for you and the operative field. It's all about moisture control, protecting the surrounding tissues, and giving you that crystal clear visibility you need to do precise work. Both are absolutely non-negotiable. Okay, we've arrived at what I believe is the most important cognitive step in this whole protocol. The patient is ready, the field is prepped, but before you touch that tooth, you need to pause. You need to assess and visualize. This is the moment to think, not just do. And the very first thing you need to think about? Occlusion, the bite. Before you isolate that tooth, you need to build a mental map of all the contact points. Where does this tooth hit the one opposing it? What about the teeth right next door? This information is your guide. It literally dictates the shape of your prep and ensures your final restoration is going to work in perfect harmony with the rest of the mouth. Oh, and here's a crucial pro tip for any restoration that's between 2 teeth. Place a wedge preoperatively. Seriously, this simple little action gives you 3 huge benefits. 1, it creates a tiny bit of separation, making your access way easier. 2, it physically protects the neighboring tooth from any accidental bumps. And 3, it shields the rubber dam and that delicate gum tissue. It's a small step with a massive payoff. You know, this entire protocol, everything we've talked about, is built around one single guiding principle: minimal tooth structure removal. The goal is always this delicate balance, right? You have to get rid of the decay, the weakened structure, but you must preserve as much healthy tooth as you possibly can, especially those strong cusps and ridges that give the tooth its strength. And that brings us to the most important mental task, especially for a clinician who's still developing their skills. Before you ever cut into that tooth, you have to visualize the final preparation. I mean it. Mentally rehearse the whole thing. Picture exactly where the walls of your prep are going to end. This act of visualization is your absolute best defense against taking away too much tooth structure. So there you have it. We've walked through the entire preoperative sequence. And as you can see, this is way more than a to-do list. It's a systematic approach that builds a rock-solid foundation for every single restoration you do. Let's just quickly recap the core pillars of this protocol.
Here it is, your 4-step game plan. It starts with the desk work. Review the record. Then prepare the field. Anesthetize and isolate. Next up, assess. Check that occlusion. And finally, the critical cognitive step. Visualize the prep before you start. See how each step builds on the last? That's how you create a foundation for success.
So I'll leave you with this final question to take with you into your practice. I want you to ask yourself, is your pre-op routine just a habit you go through on autopilot, or is it a conscious, deliberate strategy? Because the difference between those two approaches, well, that's what will ultimately define the quality of your work.
I really hope this framework helps you build a stronger foundation in your own clinical practice. For more awesome insights just like this, make sure you follow Dr. Sairang Suresh. Thanks so much for joining me.